If you're over 60, there's something important you need to know about tonight's sleep, because the way you sleep can quietly raise your risk of a stroke without any warning at all. Not because of stress, not because of what you ate, but because of how blood and oxygen move through your brain while you're asleep. You can go to bed feeling completely normal. No chest pain, no dizziness, no warning signs of any kind. But during sleep, the older brain drains blood more slowly, tolerates oxygen, drops less effectively, and becomes far more sensitive to pressure and positioning. Certain sleeping positions can slow circulation just enough to thicken blood, reduce oxygen delivery, and increase clot risk. Silently, hour after hour, without waking you even once. I'm Dr. Jonathan Reid, a physician who studies brain circulation and sleep physiology in adults over 60. And here's what most people never realize. Many stroke-triggering conditions don't develop during the day. They build overnight, when the brain is supposed to be resting, draining, and repairing itself. This isn't about fear, it's about mechanics, gravity, blood flow, venous drainage, oxygen exchange, small detail like head angle, neck position, airflow, or how long you stay in one posture can quietly tip the balance in the wrong direction by morning. Tonight, I'll walk you through 6 very common sleeping positions that millions of seniors use every night. Some feel comfortable, some feel familiar, but a few can quietly raise stroke risk while you sleep, especially after 60. Watch this carefully all the way through. If this information helps you, tap like so more seniors can see it. Leave a comment telling me your age or how you usually sleep, and subscribe with the bell on, because what you learn here may change how you sleep, starting tonight. Position number 6, sleeping completely flat. Sleeping completely flat is extremely common, and for many people it feels natural and comfortable. But after 60, this position quietly removes something the aging brain increasingly depends on: gravity-assisted venous drainage. The brain doesn't only require steady blood flow in, it also relies on efficient blood flow out. As we age, the veins responsible for draining blood away from the brain lose elasticity and responsiveness. They empty more slowly, especially during long periods of stillness like sleep. When the head is level with the heart, venous blood leaving the brain has no slope to assist it. Nothing is blocked and nothing feels wrong, which is why this position rarely raises concern. But circulation slows. Blood remains in the cerebral vessels longer, oxygen exchange becomes less efficient, and platelets spend extended time in low-flow conditions. Over several uninterrupted hours, this creates an environment where clot risk can quietly rise. What makes this position especially concerning is the absence of warning signs. There is no pain, no dizziness, no shortness of breath, and no discomfort strong enough to wake you. Sleep can feel deep and undisturbed while circulation is gradually becoming less efficient. This is why overnight neurological events often seem to come out of nowhere. The process doesn't announce itself. It accumulates silently during stillness. Nighttime blood pressure patterns add another layer. Blood pressure naturally dips during sleep. In a younger brain, drainage systems adapt easily to this change. In an older brain, that same dip combined with flat positioning can further slow venous return. The result is prolonged congestion, not an immediate emergency, but a narrowing of the brain's safety margin over time. The adjustment is simple and does not require drastic changes. You do not need to sleep upright or invest in specialized equipment. Elevating the head by just 15 to 25 degrees is enough to restore a gentle drainage gradient. This small incline helps blood exit the brain more efficiently, reduces pooling, and supports healthier oxygen exchange throughout the night. How you create that incline matters. The neck should remain neutral, not bent forward or sharply flexed. Overly soft pillows that collapse can cancel the benefit by allowing the head to tilt or the neck to kink. The goal is a smooth, shallow slope from shoulders to head, not a bend at the neck. Sleep comfort does not need to change. Rest can remain deep and uninterrupted. But internally, circulation behaves more predictably and more safely through the night. This position is not dangerous because it feels dramatic. It's risky because it feels normal. while quietly working against how the aging brain manages blood flow. Position number 5, sleeping with the neck flexed or overpillowed. This position often develops gradually. One pillow becomes two. A soft pillow collapses. The chin drifts slightly toward the chest. Nothing feels extreme, and many seniors sleep this way for years without realizing what it does to nighttime brain circulation. After 60, the veins that drain blood from the brain, especially the jugular veins, become far more sensitive to posture. Even mild sustained neck flexion can partially compress these vessels. The compression does not need to be complete to matter, it only needs to be constant. When venous outflow slows, blood remains longer inside the cranial space, increasing pressure subtly but persistently through the night. This creates a slow buildup rather than an acute problem. Intracranial pressure rises just enough to interfere with optimal oxygen exchange. Blood viscosity increases in low-flow zones. Platelets remain in contact longer. None of this produces pain or alarm strong enough to wake you, but it steadily narrows the brain's margin of safety during long, uninterrupted sleep. Many people assume that more pillows equal more support. In reality, excessive pillow height often breaks the neutral alignment between chest, neck, and head. Instead of supporting the cervical spine, it bends it. Over hours, that bend places mechanical stress on venous drainage pathways and alters arterial inflow dynamics as well. The brain is extremely sensitive to asymmetry and pressure that lasts for hours rather than minutes. There are often subtle morning clues: a mild headache that fades after moving around, a heavy or full feeling behind the eyes, slight visual blur that clears with time, neck stiffness despite adequate sleep duration. These signs are frequently dismissed as normal aging or dehydration, but they often reflect overnight circulation strain. The correction is precise, not dramatic. One pillow is usually sufficient. Its role is to keep the neck neutral, not elevated forward. The ears should align roughly with the shoulders, and the chin should not drop toward the chest. Firmer pillows that hold shape tend to be safer than very soft ones that compress during the night. If you sleep on your back, the pillow should support the natural curve of the neck without lifting the head excessively. If you sleep on your side, the pillow height should fill the space between shoulder and head so the neck stays straight, not angled. This position is dangerous for the same reason as sleeping flat. Not because it feels extreme, but because it feels comfortable while quietly altering blood flow for hours at a time. Pressure does not need to be strong to matter, only constant. Position number 4, sleeping face down. Prone position. Sleeping face down is less common after 60, but for those who still use it, the risks are often underestimated because the body feels supported and breathing feels open. The danger here is not suffocation, and it's not a dramatic loss of oxygen. The problem is mechanical stress placed on critical blood vessels for many uninterrupted hours. When you sleep prone, the neck is almost always rotated sharply to one side. That rotation persists for the entire sleep period. In younger adults, blood vessels tolerate this asymmetry better. After 60, arterial elasticity decreases and compensatory circulation becomes less reliable. The vertebral arteries, which supply blood to the brainstem and cerebellum, are especially vulnerable to sustained twisting forces. These arteries pass through the cervical vertebrae and are designed for movement, not for prolonged torsion. When the neck remains rotated for hours, shear stress builds along the vessel walls. Blood flow can become uneven or partially reduced on one side, while venous drainage from the same regions also slows. This combination strains the areas of the brain responsible for balance, alertness, and basic autonomic regulation. The risk here is not an immediate event. It is cumulative. Reduced perfusion, even at modest levels, increases endothelial stress. Platelets are exposed to irregular flow patterns. Oxygen delivery becomes less consistent. Over many nights, this creates a background environment where clot formation becomes more likely, especially during the early morning hours when blood pressure begins to rise. What makes this position particularly deceptive is that it often feels stable. The chest and abdomen are supported, the airway feels open, and there is no sense of restriction. The brain, however, does not tolerate asymmetry well when it is sustained. The brainstem, in particular, requires consistent bilateral blood flow. It does not compensate easily for hours of imbalance. Some people notice subtle effects, waking with a sense of disorientation, neck soreness that feels deeper than muscle tension, or a heaviness in the head that improves only after moving around. These signs are easy to dismiss, but they often reflect overnight strain rather than poor sleep quality. The correction is not complex. Side sleeping is safer than prone sleeping for brain circulation. Using a body pillow or firm pillow in front of the torso can prevent rolling face down during the night. If you tend to drift into this position unconsciously, positioning matters more than willpower. The brainstem does not tolerate asymmetry for hours. Comfort does not equal safety. When it comes to sleep after 60, balance and alignment protect the brain far more than familiarity. Position number 3, sleeping on one side with sustained neck pressure. Side sleeping is often recommended for comfort, breathing, and digestion, so it surprises many people to learn that how you sleep on your side matters as much as which side you choose. The risk in this position doesn't come from side sleeping itself. It comes from sustained pressure and misalignment at the neck. After 60, the carotid arteries that supply blood to the brain become more sensitive to external compression. These arteries run along the sides of the neck, close to the surface, and they are not designed to tolerate hours of direct pressure. When the head is pushed too far forward, tilted downward, or compressed by the shoulder or arm, blood flow to the brain can become uneven. This doesn't mean blood stops flowing. It means flow becomes irregular. One side of the brain may receive slightly less blood than the other for prolonged periods. That asymmetry matters. Uneven flow increases shear stress along the vessel walls and promotes platelet activation, especially in slower moving blood. Over time, this creates conditions that are harder on the brain than uniformly low flow. Venous drainage is also affected. When the neck is bent or compressed, blood leaving the brain encounters resistance. Pressure builds subtly. The brain compensates by increasing vascular tone, which further reduces flexibility. None of this causes pain during the night. It doesn't wake you up. That's what makes it dangerous. Some people notice indirect signs in the morning, waking with a heavy or foggy feeling on one side of the head, tingling in the arm that was underneath them, or neck stiffness that feels deeper than muscle soreness. These are not nerve problems in most cases. They are circulation and drainage issues caused by sustained positioning. This position becomes even riskier when combined with a thick or collapsing pillow. If the pillow allows the head to sink while the shoulder pushes upward, the neck is forced into lateral flexion for hours. That alignment compresses vascular structures without you realizing it. The fix is alignment, not avoidance. Side sleeping itself is generally safe when the neck remains neutral. A contoured pillow that keeps the head level with the spine can dramatically reduce risk. The neck, chest, and head should form a straight line, not a curve. Avoid tucking the chin or allowing the shoulder to press into the side of the neck. It's also important to change sides during the night. Sleeping on the same side every night concentrates stress on the same vessels. Even small shifts reduce cumulative strain. Uneven blood flow is harder on the brain than low blood flow. At night, symmetry protects circulation, alignment protects the arteries, and small adjustments quietly reduce risk long before symptoms appear. Position number 2, sleeping upright or semi-upright for many hours. This position often feels protective. Many seniors sleep upright or semi-upright because it reduces reflux, eases breathing, or feels more comfortable on the back. Some use stacked pillows. Others fall asleep seated, slightly bent at the hips. The problem isn't comfort, it's circulation over time. When you sleep upright for hours, gravity changes how blood moves through your body. Blood naturally pools in the legs and lower body. In younger adults, the vascular system compensates quickly. After 60, that compensation becomes slower and less complete. As blood pools, flow in the large veins returning blood to the heart becomes more stagnant. Slower flow increases viscosity. Platelets spend more time in contact with vessel walls. This combination raises the risk of small clots forming quietly during the night. The danger isn't usually what happens while you're upright. It's what happens later. In the early morning hours, blood pressure rises naturally as the body prepares to wake. When pressure increases suddenly, pooled or partially clotted blood can shift. This is one reason early morning strokes are more common in older adults. Sleeping upright also affects cerebral circulation. Reduced venous return limits how efficiently blood drains from the brain. At the same time, lower cardiac output during sleep means less reserve to correct imbalances. The brain may receive adequate oxygen overall, but distribution becomes less stable. Another factor is stillness. Upright sleeping often means fewer position changes. Stillness plus gravity is a risky combination for circulation. Muscular pumping in the legs is minimal, so blood relies almost entirely on vessel tone to move upward. That tone weakens with age. Some people wake with swollen ankles, a sense of heaviness in the legs, or lightheadedness when standing. These are signs of overnight pooling. They are not harmless symptoms. They indicate that circulation struggled to rebalance during sleep. This position is especially concerning for anyone with a history of varicose veins, prior clots, heart rhythm issues, or dehydration. Fluid loss overnight further thickens the blood, compounding the effect. The solution is not forcing yourself flat if that causes distress. The solution is support and timing. An adjustable bed that elevates the torso slightly while allowing the legs to remain extended is far safer than sleeping seated or sharply bent. Before sleep, gently extending the legs and hydrating adequately helps reset circulation. If you must rest upright temporarily, avoid staying in that position all night. Even short periods lying flat with legs extended reduces stasis. Circulation depends on movement and balance. When gravity dominates for too long, risk quietly rises. This position feels safe because it's familiar. But familiarity doesn't protect circulation. Alignment and flow do, especially during the long, still hours of sleep. Position number 1, low oxygen sleep environment. This is the most overlooked risk and often the most dangerous because it doesn't feel like a position at all. Low oxygen sleep environments quietly strain the brain night after night, especially after 60. You don't need to be suffocating. You don't need to gasp. Even mild repeated drops in oxygen, what we call microhypoxia, are enough to change blood behavior in ways that raise stroke risk. During sleep, breathing naturally becomes slower and shallower. In a well-ventilated environment, the brain adapts. In a low-oxygen environment, it cannot compensate as easily with age. Blood vessels constrict to preserve oxygen for vital centers. Circulation becomes less even. Blood thickens slightly as oxygen saturation falls. None of this wakes you up, but all of it stresses the system. Low oxygen increases blood viscosity and platelet activation. It also raises nighttime blood pressure variability, forcing vessels to contract and relax unevenly. Over hours, this creates shear stress inside cerebral arteries, the kind that damages fragile vessel walls. What creates low oxygen sleep environments? More things than most people realize. Sleeping with the head buried under heavy blankets, sleeping with the face partially covered, poor airflow in tightly closed rooms, thick comforters layered over the chest, even certain sleep masks or pillows that restrict airflow near the nose and mouth. Some seniors unknowingly worsen the problem by sleeping very still. Fewer position changes mean fewer natural deep breaths. Oxygen exchange becomes shallow and repetitive. Carbon dioxide clearance slows. The brain senses this imbalance and tightens vessels further. The danger is cumulative. One night rarely causes harm, but repeated microhypoxia night after night weakens vascular resilience. Morning stroke risk rises because blood is thicker, vessels are constricted, and pressure increases as the body wakes. This is why strokes so often occur in the early morning hours. Not during stress, but during transition. Warning signs are subtle: waking with a dull headache, dry mouth, brain fog, or a sense of heaviness behind the eyes. These are not bad sleep. They are signs of overnight oxygen stress. The fix is simple but precise. Keep the airway completely clear. Never sleep with bedding covering the face. Maintain airflow in the room. Use breathable blankets. Avoid stacking heavy layers near the chest. If congestion is present, address it directly rather than compensating with posture. Sleep should never feel air-limited. You don't need silence or darkness at the expense of oxygen. The brain can tolerate many things. Chronic low oxygen during sleep is not one of them. Protect airflow and you protect circulation quietly, powerfully, every single night. What you've just seen isn't about rare medical events or extreme conditions. It's about ordinary sleep habits that quietly change how blood and oxygen move through the brain after 60. Stroke risk overnight is almost never caused by a single dramatic mistake. It builds through mechanics: head angle, neck pressure, gravity, stillness, and airflow, acting together for hours while you're unconscious. Sleeping completely flat slows venous drainage from the brain. Excessive neck flexion compresses the jugular veins. Face down or twisted positions strain critical arteries. Prolonged upright sleeping creates blood pooling and clot risk. And low oxygen environments quietly thicken blood and tighten vessels without a single warning sign. None of these positions cause pain. None trigger alarms. That's what makes them dangerous. The aging brain doesn't need fear. It needs precision. Small adjustments change circulation patterns dramatically. A slight head elevation, a neutral neck, even airflow, gentle movement through the night. These are not comfort tweaks. They are circulation management. And the good news is this: every single risk you've learned about tonight is modifiable. No prescriptions, no procedures, no waiting. You don't fix stroke risk by sleeping less. You fix it by sleeping correctly. I want to leave you with one important reassurance. Sleep is not a passive state. It's an active period of vascular regulation. When you position the body correctly, you're not trying to prevent a stroke. You're allowing the brain to drain, oxygenate, and stabilize the way it was designed to, even later in life. This isn't about being perfect. It's about awareness. Tonight, choose one change. Raise your head slightly, free your neck, improve airflow. Let gravity work with you instead of against you. If this video helped you see sleep differently, please like it. That tells YouTube this information matters. Subscribe and turn on the bell so you don't miss future breakdowns on brain circulation, sleep safety, and aging physiology. And comment below which position surprised you most. Your question may help someone else protect their brain tonight. Sleep isn't just rest, it's circulation. And how you sleep tonight truly does shape how your brain wakes up tomorrow.